Guys, Brienne here with Get Your Fix. I just wanted to give you a little bit of explanation on kind of my recent blog post for the consistent maintenance care on kind of why it's necessary, why it's helpful, that sort of thing. So let me kind of explain what can happen. So as you're working your muscles consistently, whether it be with your job because you do a lot of manual labor, whether it be because you work out 5 to 7 days a week really hard, your muscles get what we call trigger points in them. Basically, these trigger points are what happens is our muscles get almost shortened where there's supposed to be an overlap of the muscle. It overlaps a little bit too much. We get a lot of just kind of buildup in there. And basically that doesn't allow the muscle to fire properly. It doesn't let it expand properly. It doesn't let it, basically just kind of shuts that muscle down. So when that happens, it makes other muscles work differently in order to help us function. So then we're getting these overused muscles starting to be overused because other muscles aren't working right. It's just a downward spiral. So what we can do so when you try to roll it out, you try the lacrosse ball, eventually it's just not going to help because you just need something to get in there or someone to get in there and help break things up. And that's where a medical professional comes in, whether it's a chiropractor, whether it's a physical therapist, massage therapist, someone has to get in there and actually break up those trigger points for you. There's a lot of different methods for it, depending on the professional you go to, and depending on what works for your body and what you agree to. Because there's a lot of things that I may want to do with a client, but they don't want me to. So it is what it is. But I just want to give you guys a little bit of an explanation on why kind of you need to get in there, why that consistent care is needed. Basically, if you start having pain, you start having that tightness, things just have to work differently, and over time, it's just a downward spiral of problems. So, like I put on my blog post last week, I get worked on at least once a month, if not twice a month. It just kind of depends on how my body's responding. So it's definitely helpful, definitely needed, helps with injury prevention. So let me know if you have any questions, comments on this. I would be happy to answer them. Have a good day.